Hey, 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 it is Dr. Kre. I know it's been a minute, guys, but we're back with our latest installation of the Dr. Kre and Me show. And today we're going to talk about, do I need treatment for that? So I've missed you guys. I've missed you guys, but we're back. We're back. Just a couple of housekeeping things. I'll do all of the talking and the chat and stuff after the live. From now on, that'll be the new format. And I'm going to get on here and get you some information and we'll go from there. But you know who I am? I am Dr. Kre. I am a board certified family medicine physician, and I specialize in helping people who are just overwhelmed with the current healthcare situation. They're looking for someone that there's easy to talk to, easy to access. They are having problems with getting their deductibles met. They're just over it. Well, I'm your girl. I'm Dr. Kre, and I run Brownstone Healthcare and Aesthetics, a direct primary care practice. So tonight, guys, we're going to talk about, do I need treatment for that or not? So in the event, these days we're having a lot of issues with people trying to get in for urgent visits and stuff like that. And you get the call, you call your doctor. How many of y'all call your doctor and you're like, I need to be seen today because I'm sick. And they're like, okay, we have nothing for 2 weeks, for 3 weeks, for a month. So I want you to know how to triage. I'm going to help you triage your situation so that you know if you need to be seen by a doctor or not. So number one, this is timely for this time of year. If you've been exposed to the flu, you do need to contact your doctor. So this isn't saying that you necessarily have to be seen in the doctor that same day. You may need to call your doctor. You may need to email your doctor. You may need to, however you get in touch with your doctor, call the nurse and say, hey, I've been exposed to the flu. So number one, if you've had some flu exposure. So listen, if you got flu exposure 3 weeks ago, and you're like, man, I think it's finally time for me to get treatment for the flu, then you probably don't need that treatment. So if it's been 4 days or less from the time that you've been exposed to the flu, then yes, you may need treatment for that. Yes. So let's talk about flu symptoms. You'll have body aches. You can have nausea. You can have vomiting. You'll have fevers usually. When I say fever, a fever is greater than 101. I have people that call in all the time for telecalls, and they're like, oh my gosh, I got a temp, but it's 99, but that's a fever for me. No, I want you to know about, I want you to be telling your physician about temps of greater than 100.5, greater than 101. Those are legitimate fevers. So if you've been exposed to the flu within the last 4 days or less, good chance that you got it. The person lives with you. You do need treatment. So number two, if you've been exposed to someone with known strep throat, you may need treatment for that. If it's your husband, if it's your kids, if you're eating behind each other, if they sneezing on you, breathing on you, that kind of thing, consider it. So number one, yes, if you've been exposed to the flu for 4 days or less. Number two, if you've been exposed to kissing, eating behind, drinking behind someone that's had strep throat. And you look in there, you're like, oh my gosh, it's really red back there. I got plaques on my throat. You may need treatment for that. But let's pause. The flu is a virus. You don't need antibiotics for a virus. You get Tamiflu, which is an antiviral. Mostly there are not antivirals out there to treat. Viruses just have to take its course. So you can have strep throat and it be caused by a virus. The only way you'll know if your strep throat is bacteria is if you go in, they swab it, and they send it for a culture. So if you say, hey man, oh my goodness, I got this sore throat. It's still lingering. My kid was diagnosed with strep. Then more than likely, yes, you do need treatment for that. So number one is if you have been exposed to the flu less than 4 days, within the last 4 days, then yes, you need treatment for that. Number two is if you've been exposed to strep throat, someone in your immediate family, you having symptoms, and you have a fever of greater than 100.5, greater than 101, you probably need some treatment for that. Thirdly, you may need some treatment if you have symptoms of any yucky stuff, anything that's gone on for more than 7 to 10 days. If it's a virus, it will have to take its course. Remember, we treat viruses with brat diet. That is bland foods, bananas, rice, applesauce, toast. You treat that, that's bland stuff. A virus, you got a virus going on, you do not want to go eat the best steak that you have around, okay? That will mess your stomach up. So viruses, you just need supportive care. That's what we call it in the medical field. We want to support you through that. However, if your symptoms been going on 7 to 10 days, more than 7 to 10 days, you probably need treatment for that. Like, consider getting some treatment, because you're like, I may need some blood work. I may need some labs to ensure that I'm doing the right thing. So that's diarrhea that's lasting more than 7 to 10 days. That's this fever that I can't get to break. That is this cough that I can't seem to get rid of. So the title tonight is, do I need treatment for that? So one, if you've been exposed to the flu less than 4 days, yes, you probably need treatment for that. Does that mean you need to be seen at your doctor's office? Not necessarily, okay? Your doctor's office may be able to call in something for you. You don't necessarily have to have to be physically seen by your doctor. Did you not know that 80 to 85% of your symptoms can be diagnosed over the phone? I can hear whatever it is and like, oh, that sounds like strep throat, or that sounds like the pink eye, and your doctor can treat you. That's why teledoc is evolving, or telemedicine is evolving the way that it is, because people don't necessarily have to put their hands on you. There's some things that you need to be seen for. So flu exposure less than 4 days, you do need treatment for that. Number 2 is if someone's had strep throat around you, you've had exposure to that, eating behind them, drinking behind them, consider getting treatment. Number 3, if your symptoms have gone on for 7 to 10 days or more, you need treatment for that. You may need treatment for that. And when I say treatment, I mean you may need more information. We need an exam. Somebody needs to touch on you. You need maybe some labs. You may need a prescription or not. That's where the clinical course comes in. So if it's been going on for more than 7 to 10 days, good chance it may not be a virus. So number 5, green snot does not mean bacteria. Let's talk about that. If you see green snot out of your nose, that's not necessarily meaning that you need an antibiotic. So if you lay down at night and you're like, oh my gosh, I got all this drainage down the back of my throat. Oh, I can't survive. I got this drainage. Just imagine when you lay down at night, all of this stuff just drains down your back of your throat. Your ears are draining. And you get up in the morning. It's like you're getting your balance about yourself. And you coughing up all of that stuff that's been kind of lingering and sitting in the back of your throat. So it will be discolored. So saying that the color of your gunk is green or yellow does not necessarily mean that you need an antibiotic. So be mindful of that. That yucky stuff may not be bacterial just because it's this color. Viruses can have crazy colors as well. So let's go over our points. If you've been exposed to the flu within 4 days or less, you probably need treatment for that. Number 2, strep throat exposure. Somebody in your house got it. You're not coughing with this sore throat. You may need to be treated for that. If your symptoms have gone on for number 3, your symptoms have gone on for more than 7 to 10 days, you probably need some kind of treatment. Green mucus does not mean you need an antibiotic. Okay, let's get that in our heads. Green mucus does not necessarily mean that. So be mindful of that. And then in closing, let's talk about allergies, okay? Do I need treatment for that? So when you have allergies, everybody calls, I got a sinus infection, I got a sinus infection, I got a sinus infection. So here's the question. Do you need treatment for that? So if you call and you say, my sinuses are really bothering me, the gunk is green, my face is sore, but you've done nothing at home on your own, your doctor's probably not going to give you a straight out of antibiotic. I want to know, have you done Zyrtec? Have you done Claritin? Have you done Zazol? Have you done Flonase? Have you gotten anything over the counter on your own? Because that should be your first line defense for sinuses. Because in Alabama, in a week, we can have spring weather, we can have fall weather, we can have winter weather, all within the same week. If you get enough spring type weather and the flowers begin to bloom, then the pollen can be crazy and you actually, yes, can start having a flare of your allergies. If we had a pretty warm, I would say a warm winter around here, but we had a rainy winter. So some people, you have to know yourself. I always tell my asthmatics people, hey, if you know, let's see you every 3 months, or every quarter for a complete year. That way we know when you're going to flare. So when are you going to, last year I had an attack in September and in February. So you definitely know that you need to be on your allergy medicines during that time. So sinus infections comes when your allergies are not controlled. You're supposed to be on that Zyrtec, you're not taking it like you're supposed to. You're supposed to be on that Allegra, you're not taking it. You go 3-4 weeks without it, and then all of a sudden you're like, oh my gosh, my head is about to pop off my head. Yes, your head's about to pop over here. You've not been you haven't been taking your medicine. So taking your antihistamine like you need to. Start it today. It's about the birds are starting to be out. The weather is starting to change. The days are getting longer. I was like, Zoe, it's 4:30 and the sun is still for real out. I was so excited about that. So I think that now is the time. If you have allergies, go head on. Go to Sam's, go to Walmart, get your antihistamine, start taking it. And what I think a great secret weapon is, can I share with y'all what my secret weapon is? Oh my gosh, this is such a good thing. It's saline spray, normal saline spray. I'm not talking about a neti pot. I'm not talking about anything specifically branded. I have a $1.39 little tube of saline spray. It's salty water. You spray it in your nose. Don't hold your head back so it goes down your throat. Everybody's like, I can't take it. It's going down the back of my throat. Spray it up your nose. Hold your head down and immediately blow. Immediately blow. And that's getting some of all of the allergens that you've been smelling in all day. If you're around dust, you smelling in that dust all the time. If this is swollen already, the dust can't get down your throat and out your mouth. Or the dust, if you're not sneezing, it's not coming out. Or if you're not blowing your nose. So that's rinsing out your nose, your nasal cavities, helping you rinse your sinuses out. And you're rinsing out the bad stuff. So grab your $1.39 nasal saline spray. One spray, blow. You can do that as much as you want to in a day. That is not going to hurt you. That is not going to hurt you. Now, why are we talking about this? Be mindful of the Afrin sprays. They really open you up really good. But a side effect of it is to clamp you down. So you get clamped down about 10 minutes after you're taking your Afrin. Afrin will mess your blood vessels up in your nose and cause you to have all kind of nosebleeds. Be careful. It will thin this area out. This is called your septum right here. It will thin it out. So if you on there, it's really hard to come off of it because you get used to it. You have to get it and then it clamps you back down. So I need more. And it's a cycle. So if you have to do a nose spray, do Flonase. And get you some just nose spray, nasal saline spray over the counter. And that saved my life. I have allergies in the spring. I do not take anything forward. I use that nose spray when I feel it starting to come on and it just opens me up. So let's recap. I know I went off on a tangent on that, but I think that's needed because it is about to be spring. The birds are out. The weather is getting nice. The days are getting longer. It makes me so happy. This is my time of the year. So do I need treatment for that or not? So yes, if you've been exposed to the flu less than 4 days, you probably need some kind of treatment. Call your doctor. Number 2, if you've been exposed to strep throat in your house, somebody's all on you, drinking behind you, little people, contact somebody because you probably need a swab of your throat. Strep throat can be caused by bacteria or it can be caused by viruses. Viruses you do not treat. Number 3 is if your symptoms have been going on more than a week, more than 7 to 10 days, then you need some kind of treatment, okay? You need some kind of treatment. Remember the difference with allergies and sinus infections. Allergies, treat that with the over-the-counter Zyrtec, nasal saline spray, and Flonase, okay? And if you're like, oh my gosh, I've been doing this year-round and I don't feel better, switch it up. Change it up. Change it from the Zyrtec to the Zazal. Change it from the Allegra to the Singular. Change it up. Singular is one that you need a prescription for, and it's a little bit stronger. So just be mindful that if you call your doctor's office and they say no, don't be offended, okay? Because we have things that we have to follow. Like gonorrhea is hard to treat nowadays because people have had so many antibiotics. We're doing it to ourselves because we want an antibiotic for this sinus infection, for this cold. But we hadn't only had the symptoms for 2 days. Let's have healthy guts and healthy lives and not wipe all of our good bacteria out with antibiotics. So, I'll answer your questions and your comments later. But I'm happy to be back. I'll see you in 2 weeks. This is Dr. Kre and the latest edition of the Dr. Kre and Me show. I'm so happy you came. I'm so happy you joined us. I really missed you. I am a board-certified family medicine physician, and I specialize in helping people who are terribly tired of the way healthcare is going, that they want more access to their doctor. They want a doctor that they can talk to. They want a doctor that they can rely on. They want a doctor that they can trust. And you have that here with Dr. Kre at Brownstone Healthcare and Aesthetics. Call us for an appointment at 205-202-5650 or check us out and enroll to become a patient in our direct primary care practice at www.brownstonehealthcare.com. That's brownstonehealthcare.com. See you in a couple of weeks.